Hi, this is Andrew Phillips from EM Coach presenting this month's question for EP Monthly with you. And I chose this one because it's not one of those rare questions that's great for boards. In contrast, this is actually very, very helpful for your regular daily practice. You see this fairly frequently where you have a patient who you look at them clinically and you think, oh, you've got a DVT. They have an edematous single extremity, and maybe they have some other risk factor like cancer, or they've been traveling, but you look at them and think, you've got DVT, we'll get an ultrasound to confirm it, and we'll give you your apixaban or whatever, right? But then it comes back, and even a formal comes back negative, and now you're stuck. What do you do? Because you look at them and think, man, I would have put money on you having a DVT, particularly with whatever risk factor they may have. And there are two options. One of them I have a love-hate relationship with, and that's the D-dimer. And it's good for some things. It can be a very problematic lab that I think a lot of people have feelings about. They don't want it ordered up in triage, right? Because it can work you into a hole. But it's actually been fairly well studied in this population, even those with cancer, which granted, you're going to have a higher probability of it being high, right? But if you have a negative ultrasound study looking for DVT and you have a negative D-dimer, you can feel fairly rest assured that you're not going to have a DVT and you're done. So you did your ultrasound one time, you did a D-dimer, it's negative, out they go, no follow-up necessary unless things change clinically and they need to be seen again. The other option is to do a follow-up ultrasound in a week. Both of those are reasonable options, and the issue is that it depends on your ultrasound protocols with your formal ultrasounds, but they tend to go just down to the popliteal vein, right? That's part of it, from the fem down to the popliteal vein. And so there can be very small clots or a small clot down in the calf veins, and they find their way or a way up into the popliteal vein over the course of that week. And so that's where you're seeing that discrepancy between symptoms in that leg, but not yet a positive ultrasound finding. So bear that in mind. You can use that D-dimer in your back pocket, or you can have a follow-up ultrasound in a week. Both of them are reasonable, so long as the patient, of course, otherwise has reassuring vital signs. You don't have concern for pulmonary embolism at that time. So one of those bread and butter things that's very helpful for us in regular clinical practice. This is Andrew Phillips from EM Coach. I hope you enjoyed the question.